This is Pediatric Pharmacology Part 3. Administering medications to children can be quite challenging. If you look at the picture up in the upper right, you pray that that is your child that you get to give meds to the first time. Look at the one that's in the middle. What's she saying to you as you approach the bedside? And then look at the one on the bottom. That's the more likely case. So your success is going to depend on your approach, how old the child is, how sick the child is, and the method of administration. You need to be honest with these kids. If it doesn't taste good, don't tell them it tastes good, because then they're not going to believe you when you're trying to get anything done. Ask for help in holding the child if necessary. It's okay to give a medication when the child is sitting on the parent's lap. It's okay to have the parent help you to hold them a little bit, but we're not going to fully restrain a child. It is also okay to have the parent give the medication. Sometimes the kid will look at you and just say, "No way, Jose." And then the mother just looks at the kid and says, "Okay, give it to me." You give them the syringe. We like to give a lot of the medications in a liquid form that are oral, and they'll just be able to squirt it into the baby's mouth. Now, I have on this slide, don't leave medications at the bedside. You are going to see that there are nurses who do leave medications at the bedside, but that is not going to be you. If you find medications at the bedside, you need to find out from the parent, what are they, who left them, what time they left them, and then go back to the chart and see if that nurse actually charted that it was administered. Because if those pills are still sitting there and she said that she gave them, obviously that's a medication error and it needs to be written up. So when we give medications to infants, you're going to need help holding, because they are going to fight you tooth and nail. Give them cuddling and comfort after administration. Trust me, within about 30 seconds, they have forgotten everything that you did. You want to administer the drug in an upright position, even if it means is all you're doing is putting your hand behind their shoulders, neck, and head and raising them up a little bit. You can also use a nipple, and I like to do this a lot with the infants. Put a nipple in their mouth. The first thing that they are going to do is start sucking. And we're only giving them a small amount. They start suck, 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 suck. And by the time they realize, wait a minute, this isn't milk, your medication is empty out of the nipple. So try that technique. So what you'll do is just have your medication in a syringe, put it into the nipple, they start sucking it, and just keep pushing your syringe till it's empty. And then the other thing that we do is we simply put it in a syringe, and then you want to slide it into the side of their mouth. You don't put it directly in the middle because you may end up hitting the hard palate. So slide it along the side into the back and then just give little squirts. If the child is crying, then they cry, and in order for them to breathe, they have to swallow. So they'll all of a sudden be cry, 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 gulp. And then when they start crying again, it's time to give them a little more. But don't give them a whole 5 mLs. You're going to choke the kid. So give them about a quarter to a half of an ml each time you give a little squirt. Remember that elixirs or suspensions are provided. And when you have a suspension, you need to shake before administering. For toddlers, you're going to give an age-appropriate explanation. Don't go in there expecting them to tell you how old are they, when is your birth date. You need to just go in and look at the armband, scan the armband, and then basically you're just saying it's time for medication. They're going to cry, they're going to kick, they're going to be probably your toughest customers. But be creative. We only restrain them if we absolutely have to. Possible, at least let them look at the medication and touch if it's appropriate. And then once it's all done, give them praise, give them rewards. They love stickers, but they have to be appropriate, because the younger toddlers are still going to put a lot of things into their mouth. For a preschool age child, you want to give them as much control as possible so that they're not fearful or they don't have anxiety. And they will sometimes take the syringe from you, and you Just say, okay, squirt it, and you just show them how to do it, and they'll push the medication into their mouth. Or you can put it into a tiny into the medicine cups and let them take it that way. They also love Band-Aids and stickers. So the medications for toddlers and preschoolers are going to come as elixirs, suspensions. You may have to crush it. They may have chewable tablets. So the crushable ones, we're going to put it in some kind of a syrup that is provided by pharmacy. 9 times out of 10, pharmacy has already mixed all of these medications for you, so you have them in a syringe with the patient's name and you'll just give it as is. You can mix it with a little bit of food, but only a small amount, because remember, you have to give whatever you're mixing it with. Be sure there's no contraindication for medications being mixed with food. What you don't want to do is put it with something that a child really, really likes, because it's going to change the taste of that food and they will no longer want to eat or drink it. So toddlers and preschoolers give medications upright or in a semi-reclining position when they're oral. Restrain gently. They may gag, they may choke, they may vomit. And I've seen that happen depending on whatever the medication is. Rifampin, it's notorious. It's going to go down, it's going to come right back up. If a child vomits the medication, you have to report it to the physician in order to determine whether or not we're going to repeat the dose. And sometimes they'll say, go ahead and repeat the full dose. Sometimes they'll say, hold the dose. Sometimes they'll DC the dose, which is great. And then, of course, we have the alternate route for the oral meds, and you're going to see this quite often in the form of G-tubes and the Mickey button. And you're going to see the Mickey buttons in Skills Lab. And then we can also have NG tubes or feeding tubes that we can give medications to. You'll see that in the NICU. For your school-age child, they have a far better understanding of the explanations, but they do fear loss of control. They fear that what we're going to do is going to cause pain. So minimize that. They'll usually cooperate with you and, of course, give them praise and reward. Now, your adolescents, they also fear loss of control, and sometimes they're going to have attitude. They are able to assist with decision making. And so if we're giving something that a child routinely takes at home and they like to sleep in, even though our schedule says give it at 8 o'clock, we may hold it till 10 or 11 o'clock when the child is awake. Give them praise for cooperating. There's always you go a lot farther in praising them for helping you and for taking the medication, even though it may not be what they like to do, than you would if you start belittling them and telling them to. We don't say things like, oh, be a big boy. Oh, look at your roommate. They're taking it. Or, oh, I just gave a medication to a child and they took it down. And look at you. You're acting like a baby. You don't say things like this to the kids. So these are just some helpful hints on how to be successful in administering medications to children. Move on to the next part of pharmacology.